Welcome to In a Heartbeat, coming to you from the studio of WMTV Channel 5 in Grosse Pointe Farms at the Grosse Pointe War Memorial. We are broadcast also throughout southeastern Michigan on AT&T UVerse on Channel 99. I'm Dr. David Bali, and I'm your host for In a Heartbeat. Many of you may have heard of the term sleep apnea, but may not really know what it is or what its relevance may be to your health in general. And do any of you ever suffer from insomnia? Is it keeping you up at night? Well, my special guest today is an expert in sleep disorders, including sleep apnea and insomnia, and he'll help to explain the importance of sleep disorders in our lives and how they really are very important to our health. He is a sleep disorder expert, and his name is Dr. Imad Obeid. Dr. Obeid, welcome to In a Heartbeat.
Thank you for having me here today.
It's our pleasure.
Thank you.
Dr. Obeid, maybe we could start out by having you just share with our viewers what brought you to have an interest in sleep disorders?
Well, sleep disorders, especially when it comes to sleep apnea, it's very well linked to lung diseases and stoppage in breathing. So I was first introduced during my training to the sleep apnea and sleep field in general. I did a couple of rotations there, and it is very fascinating how a breathing problem can affect your sleeping. And knowing that sleep is a good portion of your life, how that can affect your life in general.
So you, just to share with our viewers, you are a pulmonary and critical care specialist with a subspecialty in sleep disorders.
That's correct.
You know, I think sleep is one of those things that, you know, people in general sort of take for granted. And it seems to be one of the most expendable things that we're willing to kind of push away in our busy, busy lives. And I think as time goes on, as the decades go by, life gets more hectic and people are busier with families and working and activities and so on. And sleep seems to be at the bottom of the totem pole for all of that. Yet sleep is very important. And maybe you could start out by sharing with our viewers how important is sleep and what is the proper amount of sleep?
Absolutely. Starting with the appropriate amount of sleep, which is 8 hours per night. We know that this is the time that human beings are engineered, let's say, to get. So for over millions and millions of years, as a human race, we should sleep for 8 hours to be refreshed and normal the next day.
And I don't want to interrupt you, and I want you to continue on that thought, but you know, there's a time years ago where we didn't have television technology, computers, where when it was dark, you know, you had a candle for a little while, you could read or do whatever, and you went to sleep, and you probably got that 8 hours.
Absolutely.
Is that true?
That's absolutely true. Our life now and the way we live and the electricity we generate changed our lives and maybe forever. But essentials are essentials. We still need our 8 hours. And it's better to be in 1 or maybe 2 periods a day, not more than that, and then you will live a healthy life. So knowing that we should sleep for 8 hours out of 24 hours a day, that means we spend 1/3 of our lives sleeping. So if we spend 1/3 of our life, let's imagine or take this example. If you are to be a 60-year-old gentleman now, that means you lived 20 years. If I'm exaggerating, maybe 15 years if you don't sleep 8 hours, if you sleep only 6. So 15 years of your life you spend sleeping. So you wanna live it the right way, right?
Does that mean we're only 40 instead of 60?
Maybe that's correct. That's the way we should think about it. If we live the right way when we are sleeping, though. Because you're going to be 60 plus if you don't sleep well.
I believe it. I believe it. How common is lack of sleep in your experience?
Well, it is very common, and especially in the United States. We are a very productive nation. And by saying that, we know that we are maybe number 1 all the time, if not, if I'm mistaken, 1 or 2. And productivity comes from commitment to work. Most of Americans do not get more than 6 to 6 hours and a half of sleep per day. And that's a known, I believe, fact by now. So most of us will try to do they finish their work, they go back home, they have other activities they have to engage to, other household stuff they have to finish before they can go to sleep. Then they go to sleep with whatever time they left with. So,
It's the leftover
yes,
period of a 24-hour day.
absolutely.
And just to maybe give an overview, what types of health disorders or medical problems have been found to be scientifically associated with a chronic lack of sleep?
Absolutely. Beside the direct effect of lack of sleeping on your cognition the next day and how good and productive you are at work, also indirectly there are other general health problems you can suffer from. If you are already at the obesity or overweight, we know that you have risk of diabetes, heart diseases, coronary artery disease as we call it, meaning heart attack in the future, decreased blood flow to your heart, to your other system, heart failure when you have swelling in the legs and so on, when fluids accumulate in your body. When you have a predilection to those diseases, not sleeping well, especially having sleep apnea, will worsen those, will make your diabetes to show up earlier and to be harder to control. Also, the same thing for the coronary artery disease, meaning the possible heart attack in the future, the clogging of the arteries in the heart and the other systems can cause what we call arrhythmia to the heart, meaning irregular heartbeat. It can cause it while you are sleeping, but for a short period of time. But if you already have it, it will make it even worse during the day.
And you were sharing with me that a lack of sleep also has a relationship to anybody who has an inflammatory disorder. And what is that relationship, Dr. Obeid?
We know that when you have an infection, you feel you are sleepy, your temperature is high, and if we measure in your blood some factors, they are marker for inflammation. So we know that those markers are elevated. So when you don't sleep well, the vice versa happen also. Your inflammation markers will be elevated. And we believe that's the base of all other diseases, because now we know that to have heart artery blocking, it starts as an inflammatory process at younger age. Then you accumulate this plaque, and then you will have the problems. So yes, not sleeping well will cause those inflammation factors in your body to be at higher level. Then it will cause problems.
It's interesting you said that. As I share with you just before the camera started rolling, I just happened to read yesterday, there's an article in some of my psoriasis literature that showed that there's an increased incidence of sleep disorders in patients who have psoriasis, which is an immune inflammatory disorder. And the highest correlation that they found with that is those patients who have psoriatic arthritis, in addition to the psoriasis. So it's interesting how something like sleep is connected to our total body and our metabolism and the diseases that we're susceptible to.
Absolutely, absolutely.
One of the things that you see most commonly, Dr. Obeid, is sleep apnea. Could you please explain to our viewers what is sleep apnea?
Absolutely. The most common one is obstructive sleep apnea, meaning interruption by blockage while you are sleeping. And why is that? That's because if some people with anatomy, they have different anatomy of the upper airway. Some of us, because we have thicker neck, bigger body, the body habits play a big role. Unfortunately, the new disease of the age is obesity now, and that will make our pharynx, meaning the upper airway, which made of muscles, more collapsible. So when we sleep, we know the muscles usually relaxes, or the muscle relax. So when we are sleeping, all this weight will cause the airway to collapse, and you block your airway. So how could that affect your sleep? When you are sleeping, your brain is going to protect you, going to feel that you are about to suffocate, and it won't allow you to suffocate. It will defend you by waking up and waking those muscles of the airway and keep them open. So this process can take only seconds, up to 10 seconds, 20 seconds or so. But the frequency of this event happening again and over will keep your brain awake while you are sleeping at nighttime. So you are sleep deprived.
And you don't really get the quality sleep that you need.
Exactly. You
may be kind of unconscious, so to speak, for a while, but you're not really getting the quality sleep that you need.
Absolutely.
And the word apnea means
Stoppage. In breathing. I'm sorry, yes.
No, that's good. That's good. Now, you mentioned that there are some medical issues associated with sleep apnea. Are there any relationships to depression or psychologic types of
Yes.
medical conditions?
Yes. It's also proven now that if you have sleep deprivation, sleep apnea, and now we know the linkage between both, you will have higher chance of having depression and all the other mental health issues will be at higher rate. The opposite is also true. If you are already depressed and you take all depressed people and you study them, they have higher chance that sleep apnea is present in them. So we have to focus on some people or segment of the society. If you have a depression, yes, you are at higher risk. And the depression will affect your sleep apnea. Your sleep apnea will affect your depression. It will become like a vicious cycle.
Vicious cycle, exactly. It really is important in so many aspects of our lives. What about driving and sleep apnea?
This is one of the most important things, and that's when I said direct effect of sleep apnea. Sleep apnea usually is not acute disease and doesn't cause an acute problem except in driving. If you take somebody who is a college student and been up all night long, and he just took his test a few hours ago, can you ask him to drive? The first thing, if he's your son or daughter, will call him and say, don't drive, try to make it safe, and something like this. If you are sleep apneic, you are like that person who had a very severe lack of sleeping. And his cognition, meaning the way he can focus on driving, stay awake to drive correctly, will be diminished, will be severely affected.
And more highly susceptible to accidents.
That's exactly the point. It will take you only 2 seconds, your way off the road, maybe blinking longer than blinking, actually sleeping for a second, and you will have an accident.
And for our viewers, Dr. Obeid, what are some of the most common symptoms you see with sleep apnea? Perhaps somebody may have it or some version of it and not be aware of it.
Sure. What we look for, especially in the first interview with a patient, do you feel refreshed in the morning? Do you snore loudly? Or anybody mention to you that you snore loudly? Do you wake up yourself gasping and choking? Did anybody mention to you that while you are sleeping, there is a stoppage in your breathing? At one point, they were worried about your life. Are you still here? Are you still with us? And they run to the patient and ask him, hey, are you here? Are you okay? Mm-hmm. So those are the most important ones.
It's more than just waking up a little cranky.